Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with my co-hosts, Nassau Community College nursing student Virginia Gavin and Pascal Thomas, who is completing her master's degree in nursing education. And today we're talking about the traumatic events that happens to kids before the ages of 18. Our guests today are Roberta Waite, who is a professor and assistant dean of academic integration and evaluation of community programs in the Doctoral Nursing Department at Drexel University, and Ruth Ann Ryan, who is board certified clinical nurse specialist and a psychoeducational training specialist with the Healing Hurt People program in the Center for Nonviolence and Social Justice at Drexel University College of Medicine. Both are co-authors of the book Adverse Childhood Experiences, What Students and Health Professionals Need to Know. Roberta and Ruth, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you for having us.
It's so nice to have you.
Very happy to be here.
And so nice to talk to nurses. So first of all, tell me about you and why you wanted to focus on this population of people.
Well, this is Ruth Ann, and one of the things that I would say is that for my experience in nursing, I really specialized in the area of mental health and noticed really fairly early on about the effects that real stress and adverse experiences that kids have in their development, how it affects them as they grow up, as they age. And I got very curious about that and really wanted to find out everything I could to help change at that point, help adults change and grow and develop.
So there's a question, ACEs, A-C-E-S. What does that stand for, ACEs?
Well, the notion of ACEs really began with the research conducted by the Center for Disease Control and Prevention in Kaiser Permanente, and it stands for Adverse Childhood Experiences. It stems from their Adverse Childhood Experiences study. And adverse childhood experiences, which are common and could seemingly be passive experiences that one may have as a child or adolescent before the age of 18, when occurring repeatedly or in combination, can have a devastating impact on a person's development and long-term health. They can lead to stress and can result in trauma and chronic stress responses. And of course, we know that multiple chronic or persistent stress can impact a child or adolescent's developing brain, and it has been linked really in numerous studies to a variety of high-risk behaviors, a lot of chronic diseases, negative health outcomes in adulthood, such as smoking, diabetes, heart disease, and numerous mental health effects.
Okay, hi, this is Pascal. So can you tell us some examples of adversity that for those 18 and younger?
Sure. Among the things that were studied, especially in the initial ACEs study, were things like real abuse issues, like emotional abuse issues, humiliation, that kind of thing, physical abuse issues, and sexual abuse issues. And then they also studied neglect and how physical or emotional neglect have their influences on the developing child. And in addition, they took a look at what happens within the household. Is a parent treated violently? Is there domestic violence, in other words? Mm-hmm. Is there alcohol or drug use within the family? Has anybody in the family been imprisoned? Is there chronic depression, mental illness? within the family. And also they studied, and in the initial ACEs, they studied whether or not there had been separation and divorce within the family. So those were the 10 original areas of adversity that were examined by the ACEs study.
Hi, this is Virginia. I just wanted to know, what is the connection between what happens to a child and their adult health status?
Well, there's a large and really growing body of evidence about childhood stress and trauma, brain development, brain chemistry, and actually the regulation of the body's emotional stress and really fear responses systems that really are impacted. And so with the repeated stress and the activation of these systems, of the brain, it dramatically alters the formation of myelinated axons, the amygdala, the part of the brain really that activates the autonomic nervous system, releasing hormones such as adrenaline and cortisol in the body. And so that repeated activation of those responses have a significant impact, on a person's body. And they've identified strong correlations between individuals who have an ACE score of 0 to those that have an ACE score of 4 or more, where individuals with an ACE score of 4 or more have 18 times as likely to commit suicide. They're nearly 5 times as likely to ever use illicit drugs, 11 times as likely to ever use injected drugs, 5 times as likely to be an alcoholic. So there have been strong correlations where the higher the ACEs score, there's a higher predictability, if you will, of many adverse health outcomes. It's not an absolute, but there's a high correlation.
So with these ACEs scores, where are these scores used? Are they used in hospital institutions, or are they used in prison facilities? Where are they used?
Well, I think the first thing I'd like to say about that is that they are probably not used enough. Okay. This study, the initial study is over 20 years old. So a lot of this information has been available for 2 decades. And I think not incorporated. This is part of the reason why we wanted this book to focus on the need for health professionals to understand and have an awareness of ACEs, because it could be, and it, in our estimation, needs to be incorporated more into assessments, whether or not you're talking about assessments within pediatric practices, whether or not you're talking about hospital-based programs, whether or not you're talking about public health, programs that really take a look at what's happening to kids. And beyond, I think we'll get into talking a little bit about this, but beyond the individual and family dysfunction, if you will, or issues creating adversity, there are expanded issues that have been begun to be studied, having more to do with beyond the individual and family. So to answer your question, I think what we would say is that this needs to be incorporated in pretty much every health setting we could think of.
So,
absolutely.
Yeah. Would you say the same? Who was just talking? Roberta was talking? Or Ruth?
That was Ruth Ann.
Ruth Ann.
Ruth
Okay.
Yeah.
Okay, so Roberta, what would your take be on that in terms of the use of this ACEs tool? It sounds like it's specifically for the practitioner to use to refer or prescribe. Who else can use this tool?
Well, I would actually say very similarly, though, I think this tool and insights about ACEs should be universal, just like hand washing, right? Because ACEs are common and they're pervasive in our society. It's not selective. It just doesn't hit on just one targeted population. There are individuals and communities that have increased risk, but it is pervasive. So it is important to use from an educational standpoint, within clinical practice, and while our book focuses on health professions because we see there's a critical gap there, it also needs to be within our juvenile justice system. I mean, so it really needs to be within multiple entities, but we did deliberately focus on health professions because practicing health professionals academic and teaching students coming through the pipeline, it's incredibly important. And right now, the talk and the message and the awareness about it is negligible. And what's important is that if faculty who are teaching students are not aware, if they're not comfortable, if they don't have a certain level of competence about what this is, what it means, and the impact, they're not going to teach about it. So then we're going to be graduating students who still have no knowledge. So, for example, for me, I did my graduate school, my background in psych, but I did it before the study came out. So I wasn't educated on it, but I did find out about it because of the work that I'm doing in the research and scholarship that led me down the path. So it was a very intentional process. But still, many students and many clinicians are truly unaware of what ACEs means and the impact. And it could be taught starting from our sciences because it impacts at that biochemical level, all the way up through clinical courses, and not just mental health, but community and pediatrics and women's health. It can be embedded in almost every course that students are taking, particularly nursing, but as well other health professionals like Ruth Ann mentioned, with OT, nutrition, PT, physician assistants, behavioral health counseling entities, public health. Many of these different health professionals are going to be coming in contact and working with patients, families, and communities. And it really is a ripe opportunity, not just for awareness, but for education. And I'll also say a very reflective process, because health professionals are people first. Yeah. So many health professionals have themselves experienced ACEs, may not have understood it, may not understand the impact. And so how they show up and how they've been able to manage and address their own issues will impact how they're going to be able to effectively address their students, the patients, the families, and the community members that they engage with.
Yeah, so I that is profound, and I think that when health professionals understand what drove or what the patient to where they are, they're better able to treat, if you will, or to understand and intervene in ways that will be beneficial for every patient. So that's great. So would you say that if someone has had an adversity in their early life, that they are really predestined or destined to have poor health as an outcome?
No, I think that's not the case, and that's a really important thing to make a distinction about. One of the things that we have come to understand more of and need more research about is how do people respond to adversity? How do people respond to toxic stress, both within their biochemistry and their psychology? And one of the things that we have come to understand is that social support is a tremendous protective factor against adversity and against toxic stress. Mm-hmm. So we're in beginning stages of understanding how people build resilience. What are the factors that help individuals, families, communities build resilience and protect against what some might say is some inevitable exposure to toxic stress that happens in most people's lives. So it's not, the original ACEs did not ever say, the study did not say, if you've had this many adverse experiences and your score on this and this questionnaire is like a 7, does that mean that you're predetermined to have terrible health or die young or something? But it's important to make that distinction, because I think sometimes people shy away from asking some things about adversity for fear that that's going to set somebody on a path of understanding or thinking that they are predestined, and that's not the case. It's a very complex series of, what toxins do, what toxic stress does to a human being, and how we can build resilience that helps us combat that toxic stress. And ultimately, what we are hoping for are more and more protective factors that basically end up reducing the likelihood of this toxic stress entering the lives of kids.
So would you say
absolutely,
that...
and I would agree that there is no predestination, so it's not a definitive that someone will have horrific outcomes, but the buffers and the protective mechanisms are important. In the original ACEs study, there was significant focus on individual factors, or specifically right within the family, which is critical. But as we've learned more about this and with further research, we obviously know that there are also community-level adversities that contribute to ACEs. The violence, the discrimination, adverse neighborhood experiences, being bullied, if a child's in different foster care experiences. There are many other sort of significant sort of components. So, the awareness and thinking that just an individual intervention, it really is going to take a multifaceted approach and awareness collectively within society as well as health professionals. So health professionals in and of themselves will not be able to solve this. Mm-hmm. However, they have a role to play. And that's what we really want to make sure that we're highlighting. Academics have a role to play. And that's something else we wanted to show how and what can be done within those spaces that would help to move and facilitate this sort of journey along in this movement, because that's really what it is.
Okay, Roberta and Ruth Ann, let's take a quick break. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with my student co-host, Virginia Gavin, and Pascal Thomas, who is completing her master's degree in nursing education. And today we're talking with Roberta Waite and Ruth Ann Ryan about their book, Adverse Childhood Experiences, What Students and Health Professionals Need to Know. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Hi, I'm Dr. Melinda Dunn with the American Academy of Family Physicians with important information on how you can prevent shingles. If you've had chickenpox, you're at risk for getting shingles, a very painful and potentially debilitating disease. Nearly 1 in 3 Americans will get shingles, and older adults are more at risk. But adults age 50 and older can get protection simply by getting the shingles vaccine. For more on immunizations, visit familydoctor.org or talk with your family physician.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
And thanks for being with us today. This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with student co-host Virginia Gavin and Pascal Thomas, who's completing her master's degree in nursing education. And today we're talking with Roberta Waite and Ruth Ann Ryan about her book, Adverse Childhood Experiences, What Students and Health Professionals Need to Know.
Okay, can you tell us what is epigenetics and how can you help our listeners understand what that is?
Sure. Really, epigenetics describes changes that occur in gene expression, but not because of changes in DNA sequence, but because of other causes such as the environment. So there's modifications that take place. And researchers are learning that environmental factors such as exposure to toxic stress can influence how genes are expressed and cause changes in the body. So there's research that's showing that both adverse experiences and resilience can affect gene expression. So recognizing that something can be done about it is equally as important. So it's not actually a change in DNA sequence, but it is a change in gene expression based on exposure, for example, to the environment.
Can you give me an example of that? What do you mean? Give me an exemplar.
I guess an example could be even in pregnancy. So if a mom is pregnant, let's just say, for instance, and there is are significant sort of exposures, there are changes in as an organism, there are changes and modifications in gene expression, chemical markers, really that impact whether a gene is expressed or not expressed take place. Mm-hmm. There could be changes in sort of the telomere length, which are the gaps at the end of the chromosome, which act to maintain the integrity of the chromosome. And this also can result in, multi-generational transmission of trauma. So while the mother may be impacted because of these changes that happen in utero, it also can impact the child, the fetus, as well.
So this is multi-generational. It is passed down from one generation. Yes, it can be passed down. Mm-hmm. So it's sort of it's a predictor, if you will.
Yes, and I think it also helps us sort of understand a little bit more about the nature-nurture dichotomy that's been out there in science in the past and in education, and how they interact so much, and epigenetics help us, I think, understand more about that influence, the nurture, basically influence on nature.
In your book, what ideas do you offer for reducing ACEs?
Well, I think our book focuses a great deal on the health professional, as Roberta said. But I think that among many things that we talk about within the book, we talk about the need for the health professions and the education of health professions to increase awareness of the effects of adversity. We need to have more understanding within the healthcare professions. We need to have increased research that at a graduate level, nursing being one of the professions, can contribute greatly to an understanding and an advancing of the knowledge. We need also to have people within the health professions advancing policy changes, yes. Because we understand so much in the current times about the effects that public policy, health policy, policy related to issues of poverty, opportunity, those kinds of things, how much that impacts health and well-being. So we're talking a great deal about protection that could be offered through prevention efforts and through education of professionals that can advance those efforts.
So in terms of if you had to say a specific skill set that a healthcare professional needs to improve, what would that skill set be?
It's hard, but I'm going to select one. I'm not saying this is the only one, but it's a core one. I would actually say communication. Mm-hmm. And communication that's at the crux of building healthy relationships, because I think relationships is a core piece, and how you engage, how you communicate with individuals is foundational. I think a core piece and a paradigm shift that happened with trauma and understanding trauma much more is engaging individuals and understanding not what's wrong with you, but what happened to you, not a victim blaming. But I would say trusting relationships, trusting healthy relationships is core.
Very good.
I agree, and I would add, in order for a healthcare professional to form good communication, another piece is the need for self-awareness within the healthcare professional, the need for them to understand themselves, their way of communicating, their potentially inadvertent, blaming of the individual, the family, that immediately, when in a relationship, immediately impacts negatively on the capacities of the patient, the family, to feel understood and to communicate back with openness.
And I do have to add one other thing. While relationships is foundational, and I agree with what Ruth Ann just said, health professionals need to understand much more about more of the broader, not just individual or only looking at cultural competency, but looking at structural competency and what is really creating a lot of the inequities, which are part of the sort of support the traumatic experience to continue to occur. And a lot of these are those sort of upstream factors, if you will, that really influence health, including social inequities, which fall into areas of, race, class, ethnicity, immigration status, gender, sexual orientation, understanding power dynamics, institutional power, from organizations, corporations, businesses, government, schools, laws and regulations. So understanding much more from the structural competency and systems in which people live, because people don't live in a vacuum. Yeah. They're individuals, they live within families, and then they live within the broader context of our society. And those things and those structures really help to endorse and entrench the trauma that is experienced by many individuals.
Mm-hmm. If our listening audience wants to get a copy of your book or reach out to you, because this is a fascinating topic, give me your website, give me where we can find your book.
You can find the book on Routledge Publications. You can truly Google adverse childhood experiences, what students and health professionals need to know. It will come up automatically, and it's by Routledge Publications, ROUTLEDGE.
Wonderful. And if this is so broad and it has so many levels, this ACEs. I thank you so much for coming on. But if you had to leave any parting thoughts for our listening audience, what would they be? What is the takeaway?
Well, parting thoughts, I would say, we often focus on toxins that are, let's say, environmental toxins. They get a lot of press. They get a fair amount of focus in terms of education. And I'd like us to consider that perhaps the toxin that most affects the health and well-being of people is toxic stress. And that to increase our understanding, and we all know stress at certain levels is not good, but to increase our understanding about what is stressful to people and how does it affect people and how do we respond to it and how can we support each other so that we can help protect against the effects of stress. Health professionals take a leading role in that, I hope. But everybody, I think, needs to understand a little bit more about what that toxin is.
Okay. Ruth Ann Ryan and Roberta Waite, authors of Adverse Childhood Experiences, What Students and Health Professionals Need to Know. Thank you both so much for coming on our show. And this is Dr. Jeanine Cook-Garard signing out from Nursing Department here at Nassau Community College, along with co-hosts Virginia Gavin and Pascal Thomas. And we thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.